Today we're going to talk about an important issue, your heart. I'm going to ruffle some feathers because there's a new study out talking about how cannabis use may be detrimental to your heart health. Now let me give you a disclaimer. I don't care what you do in the privacy of your own home. I'm just here to give you the information as we get it, and then we'll dissect that apart. I want to give you things that will help you be healthier. So, a couple of new studies recently were released in the last couple of weeks actually that show that cannabis users under age 50 have 6 times as likely as those who do not use cannabis of having a heart attack. This is a study. One of them is over 4.3 million people, so it's a humongous study. We don't really get the opportunity to have studies this large very often. So we think that means it's reproducible. Another thing that was interesting is that people in this subset who are more likely to have heart attacks are also more likely to die of that heart attack. So what this says to me is there's something going on here that needs to be researched more, and I think everybody realizes that. We get reports of cannabis use more now than we used to because it's legal in a lot of places. And before that, people may not have been as honest about cannabis use because there was a bigger stigma attached to it. Also, we don't know the mechanism by which it damages. Is it blood vessels? Is it the heart muscle? We're not sure, and so these are all things that need to be looked into. I think we also need to interpret this with caution because sometimes people who are using cannabis are also using other substances, whether that's alcohol or tobacco or potentially illicit drugs like cocaine, which also raise the risk of heart attacks.
Drugs are bad, okay?
So I think it's very important to know your risks. Are you already at increased risk of cardiovascular disease because of family history or genetics? Maybe. Are you on medications for cardiac-related issues already? Then it's probably time to take stock of those and say, hey, do I need this extra substance in my body? What am I using it for? Am I using it to treat some sort of neurological issue or anxiety or something along those lines? Is there potentially a better option for achieving the same results that doesn't carry the same cardiovascular risk? So these are all a lot of important questions to ask. Bottom line, there's a risk. We don't know what that is yet, why it increases the risk. So take the information and be healthier.